Good morning, and thank you for joining me for my Leads Ignite talk. My name is Laura McCray, and I'm a professor and vice chair for academics at the University of Vermont. My project title was to develop and implement a departmental strategic plan for diversity, equity, and inclusion. Here are the leadership competency areas that I wanted to work on, which include those in leadership and administrative and management. A bit of background and structure. The University of Vermont Medical Center is a tertiary care level 1 trauma center with 562 beds. It's a nonprofit institution, and it's affiliated with the Larner College of Medicine at the University of Vermont, which is right next door. Here's the view from labor and delivery on the 7th floor of the hospital, looking over Lake Champlain and the Adirondack Mountains. So in 2019, our Committee for Diversity, Equity, and Inclusion in the department formed, and we created a charter and a theoretical framework for our work, which included three pillars, including a culture of inclusivity, education and training in DEI, and focus on recruitment and retention. So we created our strategic plan, which was informed by the overarching College of Medicine strategic plan. It was also informed by the culture surveys from both our hospital side and the College of Medicine. We also performed a literature review on best practice for education around DEI and found that the most impactful was longitudinal curriculum in education and repetitive work in this area. We also did work on literature review and holistic recruitment practice. So as we developed our strategic plan, we really shifted our framework, knowing that culture really is the most important piece. To have a culture of inclusivity would enhance recruitment and retention, and certainly foundational to this is education and training to make sure we're all on the same page around our DEI work. So my focus, I really honed in on the longitudinal education component. I did this in my new role as vice chair for education and academics. And we also had a framework of a family medicine network department, including many providers across the state that we wanted to include in this work. So we also looked at the mission, vision, values for our department to make sure they were aligned with our work in DEI, and focused on DEI work as important to our everyday activities. So here are the DEI education series sessions, the summary slide. Over 2 years, we did 37 sessions. So on average, more than 1 session per month. We also included our network providers in multiple sessions and did some clinic-based trainings as well. So here's some fine detail and some content that we covered. We really focused in on the intersection of racism in medicine, implicit bias, and LGBTQ+ and transgender care. Then looking at our mission, vision, values, here is our vision statement. We then looked at our mission statement and worked on editing it to include more inclusive language, including a statement about inclusive care. Next steps are to expand our educational opportunities to our clinical sites, looking at our team-based care and education there. We also want to expand our topics. We're also working on connections across the College of Medicine in several pipeline and mentorship programs, and our anti-racism task force, as well as advocacy work. Finally, we are looking at our enhancing our community engagement. We have a new foundation fund for New American Care. We do migrant farm worker outreach, and we're part of a statewide gender affirming care task force as part of our community engagement activities, and we're continuing to work on that as well. Our main area for growth is in recruitment and retention. We really need to look at baseline data and diversity amongst our faculty and staff, and then set goals and best practice around holistic recruitment, and continue to keep our lens and focus on recruitment and retention. So lessons learned are that it's a team effort, that there are many catalysts, include some fantastic people, and definitely events over the past few years that have helped to prevent inertia and keep our work going. We also needed to create time and space and some budgeting and financial support for FTE for champions, and also enhance communication across departments so that we're not doing this work in silos, but really working together. And here is my fabulous team, or at least some members of the team. There are many more, but I really credit them for their amazing work and mentorship for me. And that's it. Thank you so much for your time.